Everyone, hi, good evening. Bruce Muffson, LCSW, SUNRIDGE of Nevada. Sorry for the brief interruption. We had some transmission issues and just hooking up. Back again. So we're going to talk about now what is it to the different aspects of what's going to happen when you find yourself in a mental health crisis, you or someone else, what are the steps to take? And just reminding everybody, 128, that will be our first live paid training at 5:30 p.m. Just go to the description box, find out all information that you need. It will be on self-confidence and self-esteem. Getting right back into the topic. The person I like talking about says something like this. He goes, someone who will be helpful. I was giving an analogy of going to a restaurant. And you say something like, well, I didn't like this meal. Okay, something else on the menu. Or try a different restaurant. I didn't like this kind of food. All right, you got to learn to find someone you can rely on. That's going to happen. Take time to figure it out. But don't be afraid to do so and open yourself up. But don't stop. Keep on going forward. You got to be determined. You got to make these things work. Now, he's also brought this down as number 2. When you don't have close people nearby, many people, unfortunately, today live alone. They don't have those connections. And it's rough. It's very, very difficult when you don't have someone you can rely on. I saw this statistic a few years ago, and it really kind of struck me, and there's not much in life anymore that really surprises me. It says 175,000 people in America die principally from loneliness each year. They'll have other issues, a heart attack, a stroke, Alzheimer's, living alone, elderly, quite disabled. But the primary cause is loneliness. I didn't realize that. And for many people today, because the world is so scattered, we move around so much, and families have been in a large part splintered. You don't really have that connection you can rely on with people. The point, though, say to somebody, can I just talk to you? Can I relate to you? Here's what I do. Give an example. If someone wants to talk to me and they're having a rough time, I go like this. Send me a text message with just the letter X on it. That's it. Outing. Let's say like there's a week getaway, like a camping trip. Church runs one of those, and you go out to, 298 Park, where you go to a baseball game and you go home. I always do this. Follow up with a text message to the kids, because that's how everyone revolves around today's messaging, and say, did you have a good time? Did you enjoy yourself? Because the text message is fairly anonymous. If they shoot back an X, say, you need to contact that kid. And I've used it when I've done a lot of talk, saying, what do you need to about get for an X? I do the thing with people that are hurting. I say, if you send me an X, that means I can text a little bit, but you want the phone call. No problem. So that's how you kind of work on it. Now, sometimes I've confided in me that on paper, we have nothing on. But guess what? They thought they did. You know what? If they think that way, then I think that way. Well, you reach out. That's all. Now, here's another thing. He brought this up as well. Board is open now, guys. We are back. We're live. So any questions you have, shoot them in right now. Here's another thing he said also. Strong mental health and what trying isn't working. Can we meet up and come up with a better plan? Okay. Here's another thing. And this is part of self-confidence, self-esteem. I'm not a rock. Okay. In my daily job, I rely on a lot of people to give me information. Guess what? Sometimes I don't have the right answer, or I give the wrong answer. But guess what I do? I'm open to feedback. I'm open to suggestions. That makes you a very, very strong person and a very, very strong employee, a very strong friend or spouse when you're open. I mean, 1,000 times, agent/producer, Bruce, I want to go this way. Even tonight, he said this. He goes, Bruce, your head's like this, needs to be higher, head, fix your collar. I don't go like, how dare you? Who I am, how popular I am. I say, you're right. Follow through. If someone gives me back my work, give me constructive criticism, you could have done this better, where I would have done it, handled it. See the issue, You need another person's eyes to do that for you as well, that has a clearer head. Be open to that and learn to the people. If they say something to you, don't go with, it's stupid, it's dumb, I know better. You probably don't. And you need, so I like what he said. And he goes, we need a cheerleader or a researcher. Help explore our options. As a social worker, a clinical social worker, a lot of what I do to provide help is research. This is not going to work. This is what your insurance is good for. This is who you want to talk to. Don't go here. They're not going to help you. You need to apply this way. Here's where you go. You got to go at 8 o'clock in the morning, but be there by 7:30, so you're first in line. Your SSI, your Social Security will not work here. You need to go to this address and taken care of. You research. You tell people the truth about things. Well, I heard in court, we talk to the court clerk and find out what really goes. You go down to court on a misdemeanor charge. You're going to be rearrested because you didn't make your last 2 payments. Let me talk to somebody. Well, that's what I do a lot to people is I do research. I do the research. People are not like and wasting time. Because when you're in a crisis, you got to make things happen quickly, sometimes quicker than you want. But when you have research and you have options, it makes things better. That's why when I work with patients, sometimes people will say, well, in my opinion, I see this. Or in my opinion, I see this. Now, a lot of times they're wrong or they're not correct, but sometimes they are right. I always say this, thank you. You gave me a different perspective. Appreciate it. What did that create? No. And you're getting the help that you need. Okay. I've got some questions here. Hi, Miguel, how can I contact you? Same answer. Contact us through our email. People are starting more and more. Any questions you have, contact us. It's the best way to get a hold of us. I'm sorry. Email, that's the way to do it. And really appreciate your combos. Thank you so much. Much appreciation. So suggest, he says, so he said this time. Don't be like, let's get together next week. Let's get together in a month. When you're free, no, let's set a time. Be proactive. How about next Tuesday, 8 o'clock? Well, I know for me, like for instance, someone says to me, I want to get there with you on a Sunday. I'm like, it got to be after 7 o'clock. I'm ripping and running all day Sunday, working from early to fairly late at night. So Sunday night is the only time I really got, but I want to kind of try to like calm down from the day. So really, Monday night's not great. Tuesday's okay. It's probably the best night. Thursday's when I make these videos and I'm ripping and running. Friday night, I'm going to be synagogue. So like I don't have so much time. I'm Friday at noon, but get a time. When you're in crisis, start getting things involved. When you can't be alone, sometimes you got people like, I don't feel comfortable myself. Can you stay on the phone with me or come over until I calm down? Sometimes you got to go over. That means driving over and sitting around, just watching TV, not holding hands or anything inappropriate, but just be there. Have a couple of bottles of water, talk, take a walk, get somebody out of the house. But sometimes you guys stay on the phone, talk for a while. Sometimes I say to people, are you feeling better now? Are you feeling more in control now? Yes, because I got things off my list. I've had to listen to that, didn't judge me. Well, you're so stupid. You're dumb. You're a creep. No, man, you're in the going of Christ. You take it down. Okay. Right now, anyone any comments, feel free to shoot it down. Here's another thing, too, he was saying. Be direct. Don't go there to waste somebody's time. I may be having an issue. I may not be. I'm direct in therapy. You need to be direct when you're talking to somebody asking for help. Here's what's going on. Here's the problem. Here's the crisis. Here's where my head is at. That's all we want. You do that, we're going to be fine. Good. Asking somebody to be present might make you feel especially vulnerable. Okay, that's going to happen. But you got to be honest with yourself. And depression, he writes, is more likely to be a liar than a truth teller. Yeah, I get that. A lot of times people will say things like, well, it's not that bad. I can cope. It's not going to mess me up. It will. Get it addressed now. So many problems in life that we have started out as like, a grain of sand and ended up turning into Mount Kilimanjaro because no one wanted to talk about it. What's happening. Be aggressive in seeking help. Be aggressive in offering your help. Be aggressive in coming to a conclusion so that you can go forward. Okay. Now, sometimes he said this also. Sometimes people are going to say, I'm not really doing well, but I don't feel like talking about it right now. Okay, that's your call. Not everyone's ready to talk about things. Sometimes it's hard to talk about being depressed, being suicidal, feeling lonely, about a bad breakup, losing a job, feeling like a failure, feeling like a loser. It happens. Sometimes people, and you could see that they're hurting, but people can be like, oh man, like I just can't share it with you. Okay. You don't have to talk about it if you don't want to talk about it, but just letting you know I'm here if you do want to talk about it. That's all. You're reaching out in a positive way. That's all we're looking for. And sometimes you just want to talk to somebody. Sometimes a talk is just a talk. Like, so want to just, shoot the breeze, see how things are going. I want to get a connection to someone who's stable, who has a lifeline that I can reach out. Sometimes you realize how many people in this world have severe mental health issues on a daily basis. And to reach out to find someone they can actually talk to and just feel like I'm normal, I'm not crazy, it's relevant. One of the things that's great about the live streams we're finding out is people are saying things like, we love the group interactions, we love the feedback, because we're kind of realizing I'm not screwed up as I thought I was. And hearing people from, giving me support from the group context has been very, very, very helpful. That's really where the training is going to go as well, is to start taking that stuff and applying it to your life, like on a weekly or every other month basis, or every other week, whatever. Start taking, hey, he gave me information, advice, I can apply to myself and relate it to other people who are going through the same thing as me. Got some comments here. I hope you used the phrase song as an intro. Thank you. I wish my family listened to me. You know what? I'm just going to say this. Sometimes you got to take control and you do the best you can. And sometimes you got to, they're not going to. But try and make an effort to reach out. Never have this attitude of, I can't talk to you. True. I'm looking for these kind of people, to be honest. Yeah. I'll say this, when working with the mentally ill at times can be frustrating. Yes. Because sometimes you feel like you're banging your head against the wall, but I've accepted that. I'm giving information that I can. I'm sharing what I know. I feel I'm very qualified at my job, but there are people that are not always going to listen to what you have to say. That's okay. You just did the best you could. So just understand that. And you try to make people aware if you're having a mental health crisis, hey, I need help. I need support. Letting people know. That's all. And early interventions are so critical for our mental health. Huge, huge line. The earlier you respond to something, the better the outcome is going to be. I say this to people all the time. If you don't get something resolved in childhood, it's going to fester like a cancer, and it's going to eat you up as you get older. I don't care if you're having any kind of neurological issue, cognitive issue. The smart people are ones that say there's something wrong with Brucey. We got to get some help. We got to get some answers. When you see behavior that's off the wall, like the person's drinking a case of beer every day at 1920, that's a problem. When you see someone having to smoke weed every single day, hour after hour, oh man, I'm having panic attacks. I got to go to the dispensary again and again and again. It's excessive. Why are you doing that? I mean, I like cake, but if I'm eating a big piece of cake every single day, there's a problem there. Like, where's my relationship with food? So just going over that kind of stuff, understand why you're doing what you're doing, okay? So the earlier you get someone to say, like, this seems a little odd, this seems a little bit weird, it really saves you from a lot of grief, okay? Got some comments here. I'll take that into account. Yes, thank you. What is your take on nihilism as a positive philosophy is a purely destructive idea? Um, honestly, Grix, with that kind of thinking like this, to me, I'm a people person. I don't like being isolated. I find I learn from people. There's an expression in Judaism, a rabbi will say, um, my students learn from me, but I've learned so much more from my students. That's how I feel about this channel. You guys have opened up my mind and my perspective on a lot of different things. And even at work, yes, I'm a genius. I'm a legend in my own mind. I'm God's gift to clinical social workers, but I'm not. I make mistakes all day long. I screw up. I need that feedback of other people telling me this because I don't want to be like a man in the ivory tower with the high tower that's infallible. That, oh, Bruce, you're amazing. When you start getting that, you're a genius. There's nothing wrong with you. You're brilliant. Oh, everything you say is incredible. Run, because you're in deep, deep water. You're not getting the truth. You got to get reality in your life. So for me, nihilism is not something I would recommend for myself. My anxiety is getting worse. There's little things that set it off. Okay, here's the thing. When that's happening, sit down and say why. Why are certain things getting me cuckoo? Why are things getting me upset? Figure it out. I'm getting older and I'm not that far off from retirement in a sense. And I'm like, oh my God, can this affect, can that affect my retirement? Am I going to be comfortable? I'm realizing my thinking is changing, but I don't want to become like a lunatic where everything becomes like I'm like out of control and I can't like step back and think. So what's making me anxious? Do I have confidence in myself? Can I take the feedback? Let me go on. Let me figure out what is causing me to have that anxiety attack. So I'm saying that for you, figure out what the causes are and what can you do differently to change your thinking. Hey, my figure. And busy day, watch it through later. Appreciate you as always. Ricardo, like my anxiety gets set off when I think about the future when people seem short with me. Okay, here's the thing about the future. Don't worry about it. Worry about today. What you worry about today will help out your future. That's all. I used to be like that too. What's going to happen in 10 years, 20 years, 30 years? Waste of my time. I got to worry about just tonight. Just make sure I got here on time, got my work done at work. I already got work tomorrow. I got several hours of paperwork, typey type I'm going to have to do. I got to go somewhere, got to get home in time. I'm just worried about the next 24 hours. People get obsessed about things that really, like let it go. Don't worry about it. Focus on now. Where are you going up? Are you going like the stock market? Where are you going today? Focus on today. Let the future take care of itself. People seem short with me. Don't let, that's not your problem. And if you're having that consistently, sit down and say, why do people seem to don't want to be around me? What could I do better? Always open yourself up metaphorically and see what is you can improve upon. Because if people are giving you that kind of, that kind of cold shoulder or that kind of way they're approaching you, maybe you need to look at how you're approaching them. Okay. Girlfriend, I know that, but all the time, I feel like, yeah, don't feel that way. A lot of times people have said to us, like, I feel like I can't do this. I can't do that. I'm a loser. I'm a pain in the butt. I shouldn't be around. Never, ever feel you're a third wheel. You always have value. Always have self-confidence in yourself that you bring something to the table. Can you improve? Can I improve? Absolutely. Boy, a lot of things I wish I could improve about myself all the time. Wish I could take back several things I did this week alone. But you go forward. You get back in the batter's box. Do it. I remember one cornerback saying he got torched on an 80-yard touchdown pass, and the whole team is like booing him. You suck. And he said you can't shake that off and realize I'm the best cornerback in the league. Guy was lucky. That will never happen again. You might as well just take off your helmet, go on the sidelines, go into the tunnel, take off your jersey, take a shower, and go home because your confidence is shattered. Everyone's going to get beat. Everyone's going to be humiliated once in a while. Let it go. The idea of perfection is fantasy. It is not that way. We all make mistakes. Continue to go forward. Okay. You're the man. Thank you. What's something I can do to get negative thoughts out of my head? No problem. Think about the negative thought. Think, is it logical or illogical? Most of the time, it's going to be illogical. Move on. That's it. Is it logical or is it illogical? Now, like, that's it. Like, if I drive, it's dark here now in Vegas, but let's say, for instance, we know statistically that most accidents occur between like 5 and 7, like, whenever the sun's about to set, like the twilight, most accidents happen. They say now when you drive, particularly, of course, at night, you have to have your lights on. That's it. Just by doing, now, can I get into an accident? Can I still get hit? Of course. But when you have your lights on and you put your seatbelt on, you're not answering your phone, you're not shoving a huge sandwich into your mouth, and you're focused on the road, could an accident happen? Yes, but you're much less likely to get hit because you've done things to help prevent that. That's all. Think about it, move on. Okay. Do you have any general advice for dealing with someone who is bipolar? Yeah. First thing, read up about it. That's it. YouTube has hundreds of videos about bipolar. There's hundreds of articles on how to work with someone who's bipolar and understand them. The more information you have about something, the less you're going to personalize it. So I always say to people now, it's amazing what is available online. I continue to be amazed at that, even though I've grown up around computers, not as a kid, but as a young adult. But learn about the disorder. Learn what it is. Learn what it isn't. Learn how you can be effective. You have to step back, but read about the disorder. Watch videos of somebody who has a real bipolar disorder. What does it mean to have ups and downs? There's a lot of controversy about bipolar, but the more information you have, the stronger you're going to be. I'm going to keep moving forward one step at a time. Thank you, sir. I'll take all advice you give me. That's the goal. The goal is for people that are watching this channel right now, that are not watching the live, commenting, is I want you to have mental health body armor. That's it. I didn't get this when I was younger. I wish I did. I wish I would have had somebody I could have relied on or tuned into. There was nobody. You learned it the hard way. Right here, baby. I'm the all-star in learning it the hard way. I did so many stupid things growing up that have caused me problems even as I'm getting close to 60. Yeah, I'm going to be 58 this year because I didn't have the confidence and the self-esteem that I should have had because of the dysfunction I surrounded myself in. And 58, it was 15, 58, 45, yeah, 40. I'm still dealing with the problem. I'm still picking out the pieces of my psyche that I should never have had in the first place. Sad. That's the whole goal. And that's what the live stream is about. And that's what the training is going to be about as well. Internalize it. You can watch it again and again. We want to spread it everywhere. So thank you. Okay. Now, sometimes I do this with people too. I just, I don't like, not as detailed as him, but he goes, you need to feel connected. He has a comment. Can you check in with me on this date every day just to make sure I'm on? Okay. I will send a text message for that. If I have a chance to talk, I will talk on the phone, but I'll just say a text. I'll say, how are you doing today? How are you doing today? Is everything okay? I may get a text barrage for a few. Fine. I may get an X. I may get, can you call me later? Whatever you need. I wish I need to use a little more common sense in my car. I should get like a little stand for my phone, but I do a lot of talking, not when I'm looking at the phone. I never text in the phone in the car, but I'll have a conversation. So what does the person need? Hey, how you doing? How you doing? That's it. Ask for a check-in and ask people to check on you. Are you doing okay? Because so many people don't have anybody to check in on them. They just literally are alone. Okay. Now, some of the ways that people can check in with you. People will do this. I mean, again, this is from a way younger person who looks at things differently, and that's fine. He goes like this. You want to Snapchat, send selfies to each other. Oh, get that. Nice to see your face. I'm in the funk right now. You want to be self-care buddies. Like, let's text each other. I get it again. Can you check up on me? Make sure I didn't fall off the face of the earth. Like sending emojis. That's not my thing, but it's huge today, and I totally understand because it's a good way to get an understanding of where someone's coming from. Fine. Here's the thing. I'm old school. Okay. I text, but for me, the actual hearing of the voice is far more powerful. Nothing against the texting, nothing against the Snapchat, with the emojis, with a happy face, with a smiley face. I get all of that. But for me, I'll text, follow up with a phone call. What's going on, man? How are you doing? Is everything a-okay? That's it. I lost relationship with someone very close to me that was bipolar recently. Been struggling with my own mental health now for months and trying to make sense of it, and it's eating away at me. Okay, sit back, assess the situation. Maybe it's time to schedule a meeting with a therapist, someone you think is worthwhile that you can talk to. Also think about the relationship in itself and say, how did the relationship go south? Was it me? Was it the other person? What could I have done differently? Could I have been more supportive? Was I too supportive? Was I too intrusive? Always trying to analyze what you're doing, okay? But don't let it eat you up. If you did the best you could, that's it. Don't bang your head against the wall. You got to move on. You got to move on with your life. Okay. Good luck with that, by the way. Signing off for tonight, no problem. Good luck with everything. Do you agree that social media affects someone's mental health? It can. Yeah, of course. Because what is social media great at is the lack of contact. Because a lot of times what people do is when they talk to you, they're hiding behind the cyber wall. You don't see them. They don't see you. They can say some really terrible things to you, but there's no like opening up and looking up behind the wall. Who's behind that wall? So yes, social media used improperly can definitely damage your mental health. You have people going on sites and saying, kill yourself. You're ugly, you're fat, you're stupid, you're the wrong ethnicity, wrong skin color, wrong religion, you don't belong in this neighborhood. Die, die, die. I hope your kids die. It's disgusting. But people feel comfortable doing that because there's a certain anonymity to that. You don't have to show your face. You don't have to person, yelling at you with all that vileness. So yes, be careful what you get into and how you perceive things and how you handle things because it can be damaging. Absolutely. Help with health anxiety. Okay. First step, get a meeting with a nutritionist, see what's going on. What is going on with your health? Go to a doctor. Am I too overweight? Am I too thin? Interesting thing, I saw an article today about Ethan Sluppy. I think I'm Suppley. I think, okay. If you remember Ethan, he's almost getting to middle age now. He was that big guy in Remember the Titans. He was the offensive lineman. And he got friendly with the guy that was played by Reb, whatever, blah, blah, blah. And he was big then. He said he got even bigger. And he tried every diet in the world, crash diets, keto diets, only fried food diets, bacon-only diets, blah, 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 blah. He said none of it worked. He listened to a TED Talk in 2018 where for the first time it made sense. It wasn't what he was eating, it was why he was eating it. And he realized he had an unhealthy relationship with food stemming from his grandparents who tried to control his food intake. And he talked about his struggles and he realized, it wasn't what he was eating, it was how much he was eating. And he began to cut back, began to exercise, and the weight began to drop. And shockingly, when you eat a leafy salad with a glass of water and some lime in it versus eating 6 hamburgers loaded with French fries, your body's going to feel better. And you could eat more salad than you can more cheeseburgers. Or you can have, 1 piece of candy, but when you have 40 pieces of candy, that's a problem. So he began to understand his weight and why he was eating the way he did. He began to cut back. He lost several hundred pounds. I was reading he now does an hour of weights 6 times a week and some cardio 2-3 times a week, but he watches what he intakes, the caloric intake, and he's now at 250, 255. But he finally made peace with why he was literally at war with calories. And I understand that for myself even, stand to lose weight. So be aware of what's going on while you're doing things. So get that help first, okay? How can I get a person to seek professional help? as is eating up another person I'm close to, emphasizing them every day, carrying the burden. Here's the thing, too, I want you guys to realize. You can only get people to change when they want to change. You can give advice. You can say, I'm here for you. I'm here to listen. But ultimately, they're going to make their own decisions. That's a tough one because you always want to be like nurturing. You're my boy. You're my dog. You're my friend. You're my homie. You're my adopted sister. But if someone's going through something, unless you get them to finally recognize themselves, they have to make a change. You can be a cheerleader. You can be a supportive person. You could love them. But ultimately, they're going to make their own decision. So just be aware of that. Do the best you can, and sometimes you can only do so much. Okay. Had my own issues with seeking help, was never too hard. Good. Absolutely. Got a heart there. Thank you, Mariana. Thank you. Yeah, bad food messes up your mental state from personal experience. Yeah, no argument. I mean, I've had to change my own relationship with food over the years as well. I mean, that's it. I cut out soda. Dr. Pepper, hard. I gave up potato chips, which I could eat all day long. I love cake. I love donut. Never been a donut I hated. I'm not racial against any donut. There's no racial tension. White donut, brown donut, black donut, red donut. I'll eat them all. I have no problems with that. But not healthy. Used to consume hot dogs by the hot dog, but can't do that anymore. Got to cut that. Got to cut back. Got to cut back. Got to think about my body. I'd like to live another 20 years, hopefully, before I kick the bucket. Got to think a little bit smarter. Okay. The Sugar Act. Yeah. Just be careful. Again, like everything that we put into our body has huge impact. I understand that now as I get older, our mental health, our clinical health, it's all related, guys. Terrible diet, but I'm skinny due to ongoing anxiety issues with my stomach. Okay. That's another thing, too, I want to talk about tonight is body shaming. People hating their body. That's something that social media has really put out there so much, particularly for girls, but even for guys, too. What is the perfect body? How should you look? Let me just clarify this, guys. I know anyone here that's watching that's under 25, you get bombarded with what the perfect body is supposed to look like, the perfect face, the perfect weight. Don't. It's all marketing. Okay? Yes, some people have flawless skin, but they spend 6 hours a day getting clinical moisturizers and makeup tips. You're probably not going to have that. Be happy with how you look. Take the right steps. Eat right. Sleep right. Don't task yourself into things that are going to be self-destructive, and like who you are. The idea of like the perfect figure with a perfect body type is craziness, and it makes people crazy and cuckoo. Feel like I have to live up to it. Don't. Be happy with who you are. Take care of yourself, of course. Do the right things, but don't stress out. Okay. Okay. That's all. So, that's the thing. So for me, again, I'm old school. I will do the phone call, but I'll do the texting, but I'm always going to follow up with a phone call. Now, here's another thing you brought up. When I'm feeling like I'm a mess, I'm having a hard time. Okay. Sometimes when I go to somebody's house, I can tell within 30 seconds that there's a problem. What do I look for? Are there dishes in the sink? And have they been there for a while? Is the house clean? Okay. Sometimes people might say to you, I need help getting to the doctor or the grocery store. When you go into the house, say, hey, when was the last time you washed the dishes in the sink? When was the last time you took out the garbage? Are you wearing the same shirt that you wore last week when I saw you? Is the grass cut? When I walk into a house, I don't just walk into the house. I walk a block generally. I want to see what kind of block it is. And I'm looking at the floor of the driveway. Are there oil stains on it? Do they take care of their cars? I'm looking at the windows. Do I see the ever popular Reynolds wrap line from Home Depot? Is there a cracked window? Do I hear a dog going, meaning it hasn't been walked in a week? No exercise. I look and see what the backyard, even it's a postage stamp backyard, which a lot of backyards in Vegas are. How does it look? Is stuff picked up? Is there debris? What's the front? Is the door stained? What does the stucco look like? How do the plants look? Are they maintained? All this is telling me a lot about the person, even before I walk up and knock on the door. Like my recon, that kind of stuff. So I'm looking at that. And these things will add up. And that's a huge red flag for me is what does the house look like? Okay. Hey, Bruce. Hey, Big Bull. Hey, thank you, my man. Wouldn't that be complacency? No, selfish beats. I was just saying like this. Just look at yourself. What can you improve upon? We can always improve, but let's do it in a healthy way that's not going to be damaging to the person. Okay. Hey, Bruce, you're dropping in some love. You guys, Hammers work hard, but don't kill yourself over it. Thank you, Big Bolo. We appreciate all your comments lately. Hey, thank you so much. Enjoy his live streams. Keep up the work. Thank you. Any remedy for stress? Yes. Put down a list. I'm old school. I put things still down on paper, but you guys are probably going to use your phone. Put down what has to be done. That's the fulcrum. That's the piece between the OCD and the anxieties. You can't let things go. And once you start letting things go, you don't got to be obsessive. That's it. I got it. Did the best I could. Let's move on. Okay, hope that helps. Thank you for the great answers. It gave me some clarity in the situation. No problem. That's the whole point of this, to get some clarity, understand yourself a little bit better, and go forward. Okay, now, but just be aware that when you go into somebody's house where someone's calling you a get a ride, like, have they been shaving? For a woman, does her hair look good? Did she put makeup on? Is the outfit showing some rhyme or reason? These are all little nonverbal cues, but they're important. Okay. Sometimes I've had this happen to me. People will say, like, I'm a loser. Self-loathing. He writes this down. Can you give me a memory of myself to make me feel good about myself? You know what? We all need attaboys. Hey, you know what? You're a good athlete. The game sucked. You had some errors. You didn't play well. You're a damn good athlete. You really know how to paint. You're a good painter. Okay, the show didn't go well. Hey, you know what? He's a jerk. You were right. And you got guts for standing up to somebody. Thank you. Everyone needs an attaboy. I discussed this before in some of the other videos that they in the NBA, if teams that do this when they come off the court, not anymore with the COVID, but they go like this, like this, where they smack each other on the tush, will win on average 5 to 6 more games than teams that have no contact with each other. So understand that concept of connection. Okay. Hey, it's important. Everyone needs an attaboy. Great shot, great block. You're a great player. Love being with you. That kind of stuff. Okay. Next, going forward. Sometimes you're going to be this. He says, when you're near the end of your rope, I'm struggling right now, and I'm afraid I'm reaching my limit. Can I give you a call tonight? Okay. If someone's doing that, can I give you a call tonight? Let the person that's making the call and the person receiving the call realize things are serious. Can I give you a call tonight? You know what? Next week, I'm really kind of busy. Now, you need to reach out to somebody. So if that first person says to you, I can't have time for you tonight, number 2, number 3, number 4, find out to get someone on that line who's not going to blow you off, that's going to take you seriously. You need help tonight and now. Can't stress that. Okay. And if your little voice, I call it your spidey, not the little voice in your head, to me, it's your gut. Something doesn't seem right. Accept it. Something's odd. Same if you have a relationship with somebody. Are you going to get along with them? Your spidey sense will tell you that. Not about gentlemen necessarily like, the opposite sex or the same sex. Do you get along with somebody? I'll give you this answer. My agent / producer, as soon as I met him, I said, he's a good guy. That's it. I didn't even work with him yet, but the way he talked, the way he presented himself, I said, I'm going to be able to work with him. And I was right. I trusted my spidey sense. Same thing for you guys. When something seems right, it seems right. Okay. Love these live streams. Thank you, Miguel. You could have to apologize. But the OCD part is simple. The obsessive compulsiveness from the anxiety. It's like a peanut butter and jelly sandwich. You can just have the peanut butter and jelly. It's not going to be a great sandwich. For the peanut butter and jelly to work, to congeal, have your anxiety leading to obsessiveness because you do things over and over and over again, even when you shouldn't. Oh my God, I got that interview. I got it again. You just brushed from 10 minutes ago. And you don't understand. My breath could stink. You know that. I got to look good. My breath has to be super. Let me brush him again. The anxiety got to be too much, and now you're doing something that's overkill. Brush your teeth 5 more times, be late, get to the interview late. Now your anxiety is going to trip about that. Why don't we go earlier? Why don't you help me out? Why is the red light here? Why is Main Street being ripped up again? I can't believe. Time you get to the interview, you're so frazzled, so out of control. The interview, which goes back again to I'm so stupid, I'm so dumb. My anxiety level shoots up. And then obsessive compulsiveness is going to go back and get you again. That's how the two work hand in hand. Hope you find that answer helpful. Okay. Yes, the stream is lagging and dropping connection a lot right now. We're aware of that. We're having some problems with the stream tonight, guys. We apologize. We're doing the best we can. We were off before for a few minutes. We're just trying to do the best we can, and we're just going to go from there. So apologize. We're just doing the best we can with the bandwidth. Okay. Feel free to keep on throwing in your questions. I'm going to keep on talking. We're good. Okay. Now, sometimes he says like this, when you feel like you're going to snap, you say things like, I'm suicidal. I need help right now. Raise the alarm. When you're having a problem, when things are going really, really bad, don't be afraid to say, red flag, red flag, red flag. I need help right now. Not tomorrow, not next week, not next month. Within 20 minutes, I need support. Okay. It's an emergency. And it's the same thing like this also. If you had a heart attack, would you say, let me wait another hour? I could barely breathe. I'm on the floor. I broke my glasses. I'm disoriented. Everything is wrong. Everything is going dark. I don't want to bother anybody. I'll just sit here quietly, let it pass, till you're dead. But hey, I didn't bother anybody. You don't want to be annoying. There was a thing I saw on the Larry David show where he goes to see his father, and it's played as a joke. His father's played by an old Jewish community who passed away. He says, Mom died, and you didn't tell me? He goes, well, we didn't bother you. He goes, my mother died. What do you mean you didn't want to tell me? Well, we thought she might come out, but she didn't. And we said, you know what? Don't need to bother Larry. And the scene is played so brilliantly by these two veterans. And it's like the guy and his buddy goes, you should have come. It was great. The first night of morning, we had deli. It was delicious. It's just funny how the father's like, we didn't want to bother you. We figured it's enough on your plate right now. Because it's my mother. Keep on saying, it's my mother. What do you mean? You got something going on. Let people know. That's it. That's it. You had a seizure. You're going to sit on the floor, banging your head against it. You get a concussion. I don't want to bother anybody. We're busy. My wife's at work. My best friend, he has a lot going on in his life too. Ding, 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 ding. You got to get involved. You need help. You need help. That's it. Okay. So I wanted to clarify that. Any questions? I know we're having some problems with the back and forth. Don't worry about it, guys. Just do the best you can. We're trying to do the best we can as well. Okay. Now I want to reach out to another thing here as well. 10 ways to reach out in a mental health crisis, written by the same author, Sam Dillon Finch. He had some good points. We say this a lot, and it's frustrating at times. Don't think there is a problem with reaching out. I've had people say this to me. I was in domestic violence. It seems to be a biggie. No one said to me, are you being hurt? Until someone finally said, you look like crap. What's going on? That I had the confidence to leave this jerk. Where someone finally said to me, you need to get help with your drug problem. You're drinking too much. No one, everyone kind of tiptoed around it until someone finally said, the emperor has no clothes. Like there's something wrong here. So continue to reach out. You don't know what's going to happen. The person might take your advice today, a year, could be 10 years from now. But be honest. That's a real friend. What are you doing to yourself? You like being self-destructive? You know, you got a problem here. You're gambling too much. Your kids need to see their father. Why are you having an affair? What's that going to do for you? You know, talk to people. Reach out, reach out, reach out. We all need someone to hold a mirror to ourselves and say something is off. Okay, I like the way he said that. Okay. Um, film tracks. Do you think there's a link between schizophrenia and cannabis use? You know what? That's something I'm going to have to talk about in a later time, but there is a link now, I'll tell you now, between heart attacks and substance abuse and cannabis use. Cannabis is way stronger than it used to be, a lot more potent. People are smoking it a lot more, and we're seeing effects of it in the emergency room. So, yes, there is not necessarily schizophrenia, but could there be psychosis? There is some links to that. That more and more I'm seeing articles talking about that. Heavy usage leads to horrible stomach aches. Leads to, they're asking people in the age of 30, are you smoking weed a lot? Because the heart attacks are rising with young people. And I'm sure there's some more paranoia, memory issues. And they say the earlier you smoke marijuana, the more effect it has on the brain. So yeah, this all could lead to problems with psychotic behavior. I'm not saying there's a 100% link, but there is probably some truth to that. You're taking in a foreign substance into your lungs, and that smoke is going directly into your brain. Just think about it. I second the Macmillan circles out. Absolutely. So here's what he said. Keep reaching out. Keep reaching out. This is 10 ways to reach out a mental health crisis. So reach out, reach out, reach out, reach out. What if it was, my turn to reach out? Even after losing my friend, I began to withdraw too. So here's what he said. I wrote myself off as a burden, isolated myself, got lost in my own head. And despite knowing the danger of where I found myself, I said nothing. Okay, no one ever explained to me how to ask for help. As the grief began to snowball, he writes, I hesitated to anyone. I was struggling, largely because I didn't know how. Okay, a lot of times people will say things to you that make no sense. Do this without a rule book. So the whole point is that sometimes we get so caught up in, reach out, ask for help. But how do you reach out and ask for help when you're feeling so vulnerable? There's no field guide. One of the things that we're talking about is that people to understand there are ways you can make it happen. Got some comments here. I think it's great you take the time to do these videos, especially while people locked at home. Thank you. Bonzi's, from what I understand, cannabis use can induce psychosis to people. I imagine it's a possibility. I hear that if your family has a history of schizo and stuff, that could be, but be careful. Absolutely. I mean, again, what we're learning more and more about genetics and how the brain works, you don't want to damage your coconut. I can't say, I've seen hundreds of times in the videos already. You don't want to do more to damage the coconut. There's no problems in life as is. When I go to ER, I see people who damage themselves. Oh, man, it is hard when you see that. Don't damage yourself. Put yourself in a positive light to be successful. So yes, he's saying there is some kind of causal link. I'm not even surprised. Okay. The THC makes it worse. If you took CBD, it would be more beneficial since you didn't get the harm from it. Yeah, there's things you got to be aware of. When you walk into a dispensary, you just can't take the bud tender's advice for it. I'm not saying I'm doing anything evil, trying to do anything manipulative, but just be aware of what you're getting yourself into. That's all I'm saying. You're taking stuff into your body. You don't know how it's going to relate to your body, your situation. Just be aware. Okay. What type of psychosis? Probably, I'm just throwing this out there, but probably paranoia. Okay. Probably illogical thinking. Probably a feeling of detachment. Probably a feeling of not caring. Probably affecting your sleep. There's also a thing, if you're taking any kind of medications, you got to be careful if you're taking any kind of antipsychotic, antidepressants, mood stabilizers. Let your doctor know, because there is an interaction that could be from when taking these medications. Make you very sleepy, might give you nightmares. It could affect your judgment. So there's all these things you really got to be honest about with your medical provider when you do go see them and let them know what's going on with you. So those are things that you tend to see when you have heavy THC usage. Okay. So he talks about not knowing how to reach out to people and how difficult it is. And what I'm saying to everybody is, I get this. These are all things that are difficult, but what he wanted to do was share these 10 things to give you an idea of what you can do to reach out to others around you. Okay. Getting to the end. So if you have any questions, keep on shooting them in. We'll want to listen. Now, here's one I get a lot of. What does therapy cost? What is the price of therapy? How does it work? You know, am I getting a bargain? Is it too expensive? Is it not expensive? What does it really cost? Okay, this is something I know a lot about because I've done this my whole life, about insurance reimbursements. So this is an article that was reviewed by Timothy Legg. He's a PhD, and he wanted to give some advice on where to try and find affordable therapy. And I want to kind of clarify some of the realities of what affordable therapy really looks like and what it is and what you're paying. Okay. Here's the first point he wanted to make. And he didn't make that. I'm making this point. Know your insurance. That's the first thing. If you do have health insurance and you do have mental health care coverage, it's going to be on the back of the card, an 800 number. Call up. Everything is online now. And find out what your plan covers and what it doesn't cover. Does it cover how many visits, how many sessions? What is your copay? Because you're going to have a copay. Now it's probably between $25 to $50 on some situations. And do you have a deductible? So an HMO, which what I belong to, you don't have a deductible. But in a PPO, you might be told you have to put out $3,000 of your own money first before they're going to reimburse you. Or they're going to say something like, we'll only pay 80% of the cost. We'll pay the beginning, but you're responsible for 20% of the cost. Well, certain things in therapy can start to rack up, become very expensive. Particularly if you go to a private facility and they start dunning your insurance. You go out with an insurance bill easily in the 5 figures. That's expensive. So what's covered, what's not covered? So the very first thing I want to tell anybody is know your plan. Wait till it's a crisis time, but know what you're getting into. Okay. Miguel, good. Are you a psychologist? No. What I am is I'm a licensed clinical social worker. What is a licensed clinical social worker? I got my master's degree. I did 2 years postmasters under supervision, took a national exam, passed it, and been an LCSW now for getting close to 25 years. But I'm not a psych, and an LCSW was able to treat virtually anything. The only thing I'm working on is trying to get my drug and alcohol and domestic violence certificate. Even though as an LCSW, we deal with this stuff all the time, they want you to have something specific when you're working with people from those backgrounds. It's just the way it is. But those things I'm working on, trying to get them taken care of. But that's what an LCSW does. We provide psychotherapy. I can testify in court. I can go into a hospital, work in a prison. It's a very flexible degree, and that's like the gold seal of psychotherapy. Of course, a psychologist, but that's a different animal. Am I a psychologist? No. Psychologist is going to have 2 types. There's going to be a PSYD, and there's going to be a PhD. PhD is someone that went to a doctoral program where you have to do a dissertation. That takes about a year, and you got to do a lot of work in it to get it proven or passed by your peers. When I say peers, your professors. A PSYD is a shorter program where you don't have to do a dissertation. But both programs still require you to do a lot of hours of supervision to get to the point you take your clinical boards to become a licensed PhD. So there's 2 differences. There is some instances in way underserved populations that a PhD can prescribe medication, but that's few and far in between. PhDs do a lot of testing, a lot of evaluation, but they do not prescribe medications. So I'm not a psychologist, or am I a psychiatrist? Do I provide online counseling? No. At this point, not taking on any new patients. I have PCC outside of here, but the truth of the matter is you want to get a hold of us, the trainings are the way to start going, because the trainings are going to broaden everyone's lives and the information you're going to get. So the trainings, next week, 28th, 5:30, go into our description box if you need any information, and you'll see the price of it. It's going to be very, very affordable, not going to be excessive. And that's how I'm going to start reaching you guys who have kind of like asked for this for the last couple of years, and we've been heading towards. I don't do any online counseling. Okay, my brother's always afraid, and he has cancer all the time. It's like he actually believes it even when the doctors tell him he's okay. Okay, that's what's called false beliefs. The question is why? Why does someone have those beliefs? You got to get them evaluated. You know, why does this person have this belief system that is still going on? So the first thing you got to do is go to an MD, get some testing, get some evaluations, and see why those illogical thoughts are still there. Good luck. How do you deal with a psychologist that doesn't help you, take you seriously? Answer: find someone else. Don't put up with lousy therapy. Don't put up with someone that can't relate to you. If someone's going to be very like, this is my way, dogmatic. I mean, my style is not for everybody. I never said it was, but I'm very, very flexible. If I'm wrong, I say I'm wrong. If I could get a second opinion, I get a second opinion. I'm never like I know everything. But get somebody that you can feel comfortable with, because if you're not, then you're not getting any benefit from therapy. Move on. It's not helping you. You're paying enough money for it. You're putting time into it. You're investing part of your life in this. Find someone that knows what they're talking about. End of story. Is there a therapy? Oh, okay. I stumbled across your vids not too long ago, and I can't tell you how much I appreciate how genuinely you connect with it and break down everything I've seen from you. Thank you very much for saying that. Appreciate it. Is there a therapy clinic in a hospital? Yes and no. What I would say is this: if you do go to an inpatient hospital setting, you're going to be assigned a social worker. And you're supposed to meet with that person at least once a week and have group therapy as well several times a week. And if family therapy as necessary if needed. So you'll be assigned to a unit, and hopefully that therapist is on the ball and is seeing you at least once a week. You'll have treatment team once a week. Is it going to be like a therapy clinic per se? No. But the social worker that's assigned to your unit should have the capability of a caseload of between 8 and 12 people to see you weekly, have you do groups weekly, have family therapy as well. So you're getting the best help you need to go forward. Hope that answers that question for you, Miguel. Okay, we're almost finished, guys. So moving kind of forward. So there's the last thing I want to talk about, and I'll call it a night, is called sliding scale therapists. Okay, there are people that, let's say the average price of therapy, for instance, could be insurance $150 an hour to $300 an hour. There are therapists that don't take insurance. Well, they say you bill your insurance. Sliding scale means they'll adjust their hourly fee to help somebody out. Now, we're not talking about going from $100 an hour to $270 an hour. We're talking about someone going from $100 an hour to $50 an hour with $30 an hour. Okay, but just be aware of what you're paying for. If someone's going to charge somebody $30 an hour, they're going to have a hard time making ends meet. So they can't have an entire practice of like $25 an hour because it's not going to be cost efficient. A lot of people that will do this kind of like almost like charity work. They'll add like 2-3 hours a week to help people out. That's great, but be aware of why is someone doing that, what is going on, and how good is their therapy. I'm not saying it can't be good. I'm not saying it's going to be dreadful, but just have an awareness of what you're getting when someone's going to drop their fee as much as they're going to do. Because many therapists are not even going to think like that. They'll be like, no, I'm not dropping my fee. I charge $800 for testing to see if you're bipolar. There's no test for if you have bipolar behavior, if you have autism, fetal alcohol syndrome, I'm not dropping my rate. This is what I charge. I went to school. I have loans. I have bills. I have an office. I have partners. They're not going to drop their rate. So just be aware of what sliding scale is going to be and what it's going to do. And you can look up places like Psychology Today and goodtherapy.org.com to give you ideas of who practice. But just be aware, most of these therapists charge between 75 to 160 per session. So it's, again, therapy is not cheap. You're going to have to commit a lot of time and money to it. There's also a place called Open Path Psychotherapy Collective, mental health professionals who charge between 30 and 80. So, and they generally have only people who do sliding scale. But just be aware of what you're getting and how many hours are they committing to a sliding scale, because if they do it enough, they're going to have a hard time paying their bills going forward. Okay. Drawing circles. Got it. So we're just about out of time. Last questions, throw them down. We're ready. But I wanted to say, and then he also brings in last piece, free or low income mental health services, low fee or free community mental health clinics can provide the care that you need. There's not as many as you think. I learned that from trying to offer those services. And again, who's paying the therapist if it costs nothing? Someone has to pay them. You still got to pay the light bill. You still got to pay, the printer. So those are generally going to be state-run or county-run, but someone has to pay those therapists to keep the lights open. Like someone has to foot the bill, to keep the water bill paid. So there's not as many as you think there are. And if they are, they have limited hours and somewhat limited services because, again, you haven't really been having people basically saying, I'm going to work for free. Well, you can't work for free. That doesn't make any sense. So they're generally going to be like a state clinic, a state-run clinic, or a city-run clinic where the state is paying their salary and you come in for free and you have no insurance, but the goal is to get you insured as soon as possible today. That no one anymore will say, oh, just come in for free. They're going to say, why are you insured? And they're going to work on trying to get you insured ASAP. Okay. Tyler, love the channel. Keep the good work. Thank you. And with that, guys, I'm going to call it quits. Oh, we got a couple more. Love the channel. Keep the good work. Thank you. And just letting everyone know again, one last time, next week, 1/28/21, 5:30 p.m., of our first paid training. Information will be in our description box. Get that information that you need. It will be low cost. It will be affordable. But with this direction that we're going in, and we want you guys part of it. Self-esteem, self-respect. That's where we're going with. Got some quick questions. We'll answer these questions. How do you deal with the pressure of being raised in poverty? Every male figure around me was incarcerated. Most of my family didn't even graduate high school. I feel immense pressure to do more. Real quick, not easy. Find a mentor. Find someone that is aggressive, that is ambitious, and start to move away from people that are not to those that are. Not easy. I'm giving a very short answer to a very complicated question. But you can surround yourself with people that are not successful. You got to learn how to move on ultimately. I had to do that myself. Always reach out. Don't get stuck in the mire. Get out of it and find those that can actually help you. Okay. Appreciate the stream. Intrusive thoughts. What do you mean by that, Flim Tracks? By intrusive thoughts? My last question. So give me a little more information what you mean by the question mark, and I'll go from there. But that's all I want to kind of get out of this tonight is there are things you can do. There are solutions. There are perspectives. Don't be afraid to reach out for help. Don't be afraid to be aggressive. Be aware of what's out there in your community. Okay, gotcha. Again, getting these thoughts too. You're not alone with this. Like sometimes I feel like I know it's illogical. I'm going to get fired. I'm an idiot. I'm a moron. Is this live stream going to go tonight? Am I going to be able to relate to a new client or a new situation? I'm getting too old for this. I've done it before. I'll do it again. That's it. Look at your past success and push those thoughts out of the way. Am I really a failure? Am I really a jerk? Have I done anything that self-destructive? If I haven't, I can figure it out and I can move forward. That's all. Oh, here we go. Of course, a million questions now. Will my depression ever be fixed? Not necessarily fixed, but it can be kept at bay. 3 things, real quick. Lifestyle, who you hang out with, and if you need medication or counseling, And oh, what do you do today? And exercise. You do those things, it'll be not, you're not going to get rid of depression, but you can keep at bay. Hope that helps. You think it's bad to talk to yourself in the head all the time? I do. Don't worry about it. Yeah, I do. Don't answer back in front of people. They get nervous. But yeah, I do all the time. Yeah, no problem. Nothing wrong with that. Work with children, and my question is, what's the best reinforcement to give a young child dealing with family issues and at times they're not to deal with their anger? Just say to them, you know what? I get it. You're right. You have every right to be angry. No problem. Poverty sucks. Stupidity sucks. Being around dumb people who are violent, aggressive sucks. What can we do to make you handle it better? Acknowledge and give a perspective. What can we do to help you learn how to control it better? That's all. You're right to be angry. But what can we do so it's not self-destructive so that you're getting better? Okay, guys, that's it. SUNRIDGE of Nevada, thank you. I'm not going to say it's ad nauseum about next speaker. The light therapy twice didn't work. Give up. Anything else? Find a therapist that works with you, that gives you what you to be successful. Should take Adderall if it helps with school. Go to a qualified psychiatrist, not just a GP. And what is the pros and cons of taking Adderall? Because sometimes it does help. I'm not saying medication won't help, but start to a psychiatrist that can give you some advice and then probably have some counseling with that as well. There is the best. Yes. Teen take Adderall. Yeah. So that's what I say to you, Jose. And thank you, Mike. Trial and error. Right. You tried. That's going to work the first time. Trust me. But every bite is very, very different. And with that, guys, for tonight, much appreciation. We'll see you guys next week, and all the best. Thank you, guys, and all your comment. Have a good night.